record. Okay, my name is Lisa Kelly and I'm board president of Emham. I'm also a mental health provider in the community. Emham, if you haven't attended any of our webinars, we basically are we're a relatively new organization, and our mission is to promote mental health education to the entire community and to work on collaboration between providers and to reduce barriers to care. So we put together a series of webinars for April called Between These Four Walls. And the second one that we are doing in April is one on adolescent mental health. The idea being that during COVID-19, there were some particular mental health issues that got worse. And so adolescent mental health and suicidality we felt was really important to talk about. And we are so delighted that Amberly Nichols is here today. Before I introduce Amberly, I will let everyone know that we will be monitoring the Q&A and chat box for any questions. Amberly will stop periodically for questions, and we'll stop probably by 10 till and again open things up for questions. I will send out an evaluation at the end of our time together, and I will send out later a copy of the PowerPoint presentation, your certificate of attendance, and we have a list of resources that we also hope will be useful for you. So Amberly, I'd love to introduce you. Amberly is a private practice clinician serving children and families in the Michiana area. She got her undergraduate degree in social work from St. Mary's College in South Bend and her graduate degree in clinical social work from New York University. Amberly is a registered play therapy supervisor and certified autism specialist. She's also the mother of teenagers and enjoys participating in the local theater scene, which all leads to her being a little dramatic. So Amberly, welcome you, and we thank you so much for being here and presenting on adolescent mental health and suicidality, in particular during the COVID-19 pandemic.
Well, thank you, Lisa, and thank you everyone who is attending today on talking about how the COVID-19 pandemic has influenced mental health. And I was actually talking to Lisa earlier that even myself, over the last couple of days preparing for this presentation, my own anxiety and stress level has been high because this isn't typically how I do a workshop. Usually when I'm presenting material, I can see the audience, I'm getting feedback from the audience, I'm asking questions, I'm facilitating conversations. So I'm a little more anxious today than I typically am, so I thank you for your patience with me if I get a little tongue-tied at certain points. Hopefully I can do this topic justice. And to start, we're going to do our first poll question. I'm going to give you a second to answer that poll question before we move on to the first slide. In just a few minutes. Those numbers are like, woo.
How long do you want to give this?
I was looking up there. It looks like most people have voted. Okay, the 71%, oh, 70%. I guess a couple more people. We've got 6 more people who can answer, but we'll just give it just 15 more seconds here to see. We've got the majority in. Okay, there we go. So it looks like I am not at all surprised to see that 71% either professionally or personally, you're noticing an increase in mental health needs or have been impacted by mental health during the pandemic. And that absolutely coincides with what we are starting to see. So moving on. So we know that mental health needs are increasing for children and adults, and we know that information from a couple different sources. There has been past research done during pandemics and past research done during periods of economic instability, which tell us that when stress increases, mental health needs increase. So we kind of could see this brewing on the horizon, but there's also current and emerging research being done, and we'll talk about a study in a little bit that's more current and specific to COVID-19. We are also seeing numbers increasing just if you pull health insurance claims, and you can see the numbers of people who are seeking help for things like mood disorders, suicidality, substance abuse disorders. I think that it's important to point out at this point, you look at those health insurance claims and you can see those numbers increasing. What we also know is that this pandemic has hit underserved and vulnerable populations hardest. And so some of that has to do with access to mental health care. And an inability to get to those services. So we see the numbers of health insurance claims going up. You can only imagine how much higher those numbers are and how many more people are suffering with mental health issues that aren't being addressed just because of that lack of access to services. It can be really frustrating. I know even in this area, we're pretty taxed right now. Many agencies are on waiting lists because those needs are just so great. We know that stress has a negative impact on mental health. The level of your stress, the higher that level is, the more likely it is that you are going to struggle with some kind of mental health crisis or some mental health issue. And as we all know, COVID-19 had a lot of that stress to go around, starting with the economic stress and instability. Many of us had hours cut at work. Many of us lost our jobs. Many people were struggling with trying to figure out, how am I going to do this work from home? Can I even do that? If I have children, how am I going to manage my workload, get my work done, and care for my children? Daycares were shut down, schools are shut down. So now I'm possibly working, possibly managing children, and also trying to facilitate their education. You know, teachers have been wonderful through this whole process. It's just been really frustrating and stressful for everybody trying to manage that. There were many homes where at least one parent had to quit their jobs in order to care for their children. You can imagine the impact that that had on single parent families who, especially with younger children, had to quit their jobs in order to care for their children. Navigating the unemployment system was very stressful. So there were some policies put in place to keep people housed, and there were food programs, but even accessing and navigating those systems were really stressful and difficult. On top of that was the fear of getting sick or losing a loved one due to the illness. And especially in the beginning, if you remember, we didn't really know how it worked. And so people were worried, you know, is it on surfaces? Could it be on my clothes? I know a lot of people who still had jobs through the pandemic would come home, change out of their clothes, shower. We were wiping down packages, wiping down groceries, which is just that extra other thing that we didn't have to think about before. And sometimes if we're already at our tipping points and we just have to add that one more thing, that can be really stressful. On top of the illness itself, many of us did get sick and are still dealing with the implications of that illness on both employment and just how we're handling our day-to-day lives. The actual loss of a loved one, many of us lost people, or we have loved ones who have lost people due to COVID-19. It really complicated our grief process. In many cases, we couldn't grieve the way we would normally grieve through funerals or gatherings with loved ones to memorialize the people that we loved, and that was complicated. And so all of those were playing together. The biggest piece of this that we're going to talk about today, especially as it impacts our kids, was that social isolation, because that social isolation makes the intermingling of all of those other things so much harder. Okay, so for one part, for the adults, we ourselves lost our support system. So whether those support systems were people or other activities that we used in order to cope, those were not available to us. So either we couldn't afford the things that we used to do in order to cope, or those things just weren't even available to us. So it's not like we could gather with a bunch of our friends over dinner to blow off steam like we used to do to cope. And so that impacted us. It also impacted our kids. So sports seasons were cut short for a lot of our kids. Those sports teams were where they were getting their socialization, but it's also a way where they were moving their bodies and being healthy, and they couldn't do that anymore. I know in my own household, I don't have very sporty kids, but my kids are involved with theater, they're involved with band. And so now, again, they didn't have that social outlet, nor did they have that creative outlet available to them. And it's just been really difficult. And of course, with school being out, that also created a situation where they just weren't able to interact with their peers anymore. And it was very, very difficult. So I was seeing some examples of, so this is already a really difficult time of life for our teenagers, where they're trying to form their identities and be with their peers anyway, under the best of circumstances. And then when you add COVID on top of that, it's been really, really difficult. There was a recent study, so by the American Academy of Child and Adolescent Psychiatry, and that study looked at data from previous pandemics, but also specific data from COVID-19. And they found that children who had experienced forced isolation or quarantine were 5 times more likely to require mental health service input and experienced higher levels of post-traumatic stress. And that same study found that loneliness was associated with future mental health problems up to 9 years later. So these are, we know from past experience that this is going to have an impact on our children for many years to come. The strongest association seemed to be depression, and that was across children, adolescents, and adults, that loneliness really contributed to depression symptoms. And so let's talk a little bit about what that social isolation was doing to our kids. As I mentioned, developmentally in adolescence, this is the period of time where they're really looking to their peers to develop their own sense of self and who they are as people. And so my mom used to refer to this as the cave up years. So if you remember being, 12 to 16, 17 years old, you'd kind of cave up in your room and you're listening to music and you're talking to your friends. In my day, it was the phone, and now we've got social media. But we would do that in preparation for the next school day. What am I going to say to these people? How do I fit into these groups? And with the pandemic and with the quarantine, our kids weren't able to have those organic interactions with their peers. And it's really thrown a lot of them into a tailspin, because how do I fit into the social structure? And who am I now apart from that? And so a couple of examples I know that there was one family and one kiddo who was really struggling with her social circle. She had a group of friends that she was really, really close to, and the friends' parents were able to tolerate some social gatherings. They were able to facilitate some meetups through the pandemic, but because she had vulnerable members of her household that could not afford to get sick, she wasn't able to participate in any of those gatherings. And so through the summer and through the beginning of the school year, this group of friends that were very tight knit started to separate. And now she's not as close to these other kiddos that she was hanging out with. Even though school is back in session, because she lost that period of time with them, they're hanging out, they're enjoying each other. She's just kind of feeling awkward and apart from them, even though they're all back in school together. There's another example that I had of a kid who was in high school and had always dealt with a little bit of social anxiety, but was just starting to get his legs under him. And he was starting to make friendships and he was starting to come out of his shell. But then COVID hit and he wasn't close enough to those, there were these fresh social connections that he was making, and he just didn't feel close enough to them to be able to reach out and say, hey, can we get together, or can we meet up on, a Discord server? Can we get together and take a walk outside? He didn't feel connected enough to those fresh social connections. And so as school is getting back into session, he's also kind of feeling like an outsider. Which brings me to the concept of reverse culture shock. Now, I have not been able to see any research on this, but this has been almost a universal experience for the kids coming into my office through middle school and high school, is they're experiencing this reverse culture shock. And so for anyone that doesn't know what that is, when you if you've spent any time in a foreign country, either for vacation or maybe you took a semester abroad, or you were just traveling, spent any amount of time in a foreign country, there's this period of time where you are acclimating to that culture. Things aren't as familiar to you. You're trying to figure things out, but you acclimate to it and you enjoy it and it feels okay. Maybe it doesn't. Maybe some things are a little shaky, but you get used to it. When people come back into their home country, they experience kind of that same phenomenon. So I got used to how things were run over here, and now all of a sudden I'm back into my home environment and things are kind of the same, but also a little bit different. And so where that applies to kids in school is I remember having to get up early for school and having to do all of the usual things that you do to school. And, I can pass through classes and I can communicate, but it's just not, it doesn't feel the same to me. I expected that I was going to get into school and all of my issues were going, my concerns were going to be kind of gone. But now I'm realizing that things just don't feel the same. So for some kids, I see this particularly with kids who have friends who maybe had made the choice to finish out their school year virtually, but they were really good friends with them and not so much maybe friends with the other kids that were still attending in-person school. So who do I sit with? The kids that I usually hang out with aren't even in school anymore. With the change in the school year, some of the kids that they were close to, they might still be going to that school in person, but nobody's in the same classrooms anymore. And I don't even know how to talk to these people. Something else that's happened is there's no consistency. So we might be back face to face, but we never know when somebody's going to get contact traced. So that's when you are identified as someone who's come into contact with someone who has been diagnosed with COVID, and then you need to quarantine for a couple weeks. So that really throws you out of orbit too, because am I in school, am I out of school, and having to go back and forth has been very, very difficult for these kids. Academically, it's been difficult too for our kiddos because of not just because of the material that they're getting. I think and again, our teachers have done an amazing job, but some kids are just really having a hard time with learning the material for school, both just because it's hard for them in some situations to sit in front of a computer and learn virtually and listen to lectures for several hours at a time and still following the same school routine, but just at home in front of a computer. And in some situations, especially when e-learning in the very beginning was happening, it was like parents were having to teach them, or they were kind of having to facilitate their own learning in some situations. And so even kids that were really, really good students at the beginning of the pandemic have really struggled, not just because of the material and processing the material, but when you think about kids in a classroom, they have a lot of organic sensory input when you're in a classroom. So you're getting that input from the teacher and what the teacher is saying. You're getting that input from the kids who are around you. So if I'm taking a test, or I'm supposed to be taking a test, and I kind of get distracted, I'm looking around the room, oh, we're supposed to be taking a test right now. I should pay attention. I should look at my paper. Or you've got a teacher there to say, hey, you look like you're struggling. Can I give you some help? So when you're at home doing all of that stuff, you're just not getting the same sensory input or social input that usually helps kids stay on track. So it's been really difficult for them. Okay. Does anybody have any questions so far on anything that I've said? I don't see any. Okay. So let's look at how that stress impacts some of these specific mental health issues. The highest numbers of anxiety and OCD that we're seeing, according to the research, is highest among 6 to 12-year-olds. And I will say that I would agree with that based on what I'm seeing in my office, but also kind of what I'm living through in my own house. I live in a household with a very anxious 12-year-old. And so I'm going to give you some ideas of what anxiety can look like in your home, what to keep an eye out for. Psychosomatic complaints can be things like tummy aches, headaches. A lot of families are struggling with that Sunday night dread. So maybe your kids have been okay for the weekend, and then around 5, 6 o'clock Sunday night, your kids start complaining about, my stomach hurts. I don't know if I can go to school tomorrow, or I've got such a bad headache. I don't know if I'm going to be able to sleep and go to school tomorrow. A lot of that is connected to that anxiety. I've also been doing this long enough that I've known not just one, but several kids who will spike an actual fever if they're under enough stress. And I think that the important thing to keep in mind when you see the word psychosomatic is, some people are inclined to see that and think, well, it's in your head. If you would just relax, you wouldn't have those symptoms. And that's not really how it works. Your physical health and your mental health are very closely connected. They play together. And so these are really real symptoms that these kids are having. And so as a parent, it can be hard sometimes to figure out where is the line. To some extent with anxiety, you want to help them push through that gently, so that they can kind of confront that anxiety and get through it. And in some cases they feel better. But I also have several kiddos on my caseload where their psychosomatic complaints due to anxiety are so intense that they are dysfunctional and they just can't make it to school. If that seems to be the case for your kid, that would be a time to reach out to a professional to kind of help iron out what is something that we can push through and what's something that we really need to take a look at and accommodate. An inability to concentrate is often a symptom of anxiety. Naggy or repeated questions. This is a fun one. I'm going to give you this. This is one that drives a lot of parents crazy. And I can attest, I can be one of these parents. So here is a question that illustrates this from my own experience over the past week. So the question is something like, hey, Mom, the next time we get groceries, can we get Chips Ahoy cookies? Sure, we can get Chips Ahoy cookies. We can put it on the grocery list. We can get the cookies. Time goes by. Hey, Mom, did you remember we were going to get Chips Ahoy cookies the next time you get groceries? Yes, I remember that. We wrote it down. We're going to get the Chips Ahoy cookies. Time goes by. Hey, Mom, do you know when we're going to get groceries? And do you remember that we're going to get the Chips Ahoy cookies? And you're like, we've had this conversation a million times. You know that the answer to this is yes, we're getting the cookies. Why are you still asking me that question? And it's a comfort. It's a comfort thing. It's really driven from that anxiety. Kids have so many things that are going outside of their scope of control right now that they're going to try to control anything that they can. And so even though they already know the answer to it, just hearing you repeat back to them, yes, we're getting the cookies, is a way for them to just manage that environment and hear that, and it's comforting to them. So it can be irritating, but that's really where it's coming from. A loss of appetite can be part of anxiety. I know even me, myself, if I'm really nervous, I don't always want to eat. Some kids even go on a bit of a food strike. It seems like it's hard for them, even foods that you know that they enjoy, their tummies are just too upset and they just really can't eat, or they feel like, they're going to throw up if they eat. It can get pretty intense sometimes. Constant worrying or negative thoughts. One of the negative thoughts that I've seen come up several times in my practice is about those social interactions with friends. I don't think my friends like me. What if my friends don't like me? What if I'm afraid that if I can't score this goal in soccer, that my friends aren't going to like me anymore. Or difficulties with kids in school, a lot of really intense anxiety around not knowing an answer in school. And so a lot of these kids won't even ask questions because they're so afraid that they're going to be looked at differently by their peers or get in trouble with the teacher if they admit that they're having trouble with something. And then that'll come up a lot, because a lot of times we'll ask our kids, they're bringing home homework that isn't complete or they're not doing it right. And one of the things we ask them is, well, why aren't you asking for help? Sometimes the answer is, I don't know. But a lot of times, if you can dig into it, it's just because they're so afraid of how they're going to be viewed if they're asking those questions. So it's an obvious solution for us, but it can be really difficult for an anxious kid to ask for that help. Now, I have bolded and underlined irritability and misbehavior, but we're going to put a pin on it because we're going to talk a little bit more about OCD before we get into it, but that irritability and misbehavior is really an important factor. And I think it's probably one that as parents, we struggle with the most when our kids are kind of being angry little boogers, but we'll talk about that in a second. OCD can look like, so we're going to talk about intrusive thoughts first. Intrusive thoughts can be really, really disturbing for parents because sometimes those intrusive thoughts can be sometimes kind of gory and sometimes kind of violent, which can be obviously really concerning for parents when you have a child coming to you in distress because they were thinking about running out into traffic. Or you'll hear them say something like, my brain is telling me to punch my brother. Or when I walked past that knife, I thought about picking that knife up and stabbing my hand with it. Now, those sound like extreme examples, and they are. It can be really frightening, but it's actually not that uncommon with kids with OCD who have those types of intrusive thoughts for that theme to be a little bit violent. The key here is that it's causing distress. These kids don't want to run into traffic. These kids don't want to be violent, and they don't want to hurt anybody. It's kind of a brain glitch. So one of the things that I talk about with my kids with OCD is sometimes our brains make garbage thoughts. And so where does garbage go? Garbage goes in the trash. So that's kind of the language you can use with the younger kids is your brain is having a garbage thought. And I know that that's really scary for you. We can throw that in the garbage. For older kids, you just validate the fact that, yes, I know that that's really scary and disturbing to you, but I know that you're not a violent person and that you wouldn't really do it. This is part of your OCD. So we can recognize that thought for what it is. It's just a thought. It's not reality. You're not really going to hurt anyone. But it's just really important that as parents that we try to kind of underreact to that, even though the content seems so intense. We keep ourselves regulated. We reassure our kids that it's a brain glitch and it's not real, and we can move on to that from that. Magical thinking. One of the best examples of magical thinking is just that old saying about if I step on a crack, you'll break your mother's back. So there's a thought and then there's a behavior that goes with the thought a lot of times, but they don't necessarily go together. So one example of that from my own practice would be a kiddo who, if I don't have my room arranged exactly the way I want it, I won't be able to sleep. And if I can't sleep, then I'm going to be sick tomorrow. So this is different from, a lot of times we hear people say, I'm so OCD because I like things to be, arranged neatly. I'm one of those people. I like things to be arranged neatly. The difference is it causes so much distress when things aren't exactly right. And sometimes the behaviors don't even, what you're afraid is going to happen doesn't even have anything to do with what you're doing. Someone might go through 5 and 6 and 7 times, making sure that the teddy bear is exactly where the teddy bear is supposed to be. The glass of water is exactly where it's supposed to be. The pillow is exactly where it's supposed to be. And I'm so afraid that if things aren't lined up exactly the way I want them to be, that I'm not going to be able to sleep. And so some of these kids may stay up until 3 o'clock in the morning, checking and checking and rechecking to make sure that those things are okay so that they can then sleep. Which is I kind of combined the compulsive behavior and the magical thinking. Those things often go together. One of the things also that I'd like to point out about the OCD that I've noticed is, so for the kids who are already predisposed to anxiety and OCD, this pandemic made their symptoms worse, and they weren't necessarily directly connected to COVID or getting sick from COVID. In some regards, they were, especially kids who have a really high obsession with contamination or getting sick. It could take the form of OCD, but that wasn't necessarily the case. I also saw an increase in obsessive compulsive behaviors that didn't have anything to do with getting sick or with contamination. Ritualistic behaviors are behaviors that are repeated, and they have to be repeated in a certain order, in a certain way, in order for that child to feel safe. So it's not just that I'm washing my hands several times a day. I have to turn the tap on and off a certain number of times. I have to have a certain number of pumps of soap. I have to wash my hands in a certain order. If I get distracted, I'm going to have to start over again. If somebody interrupts me or says something to me before I'm done, I have to start over again. So that's kind of the nature of a ritualistic behavior, things that have to be done in the same order in order to feel like it's been done. All right, and also irritability and misbehavior. And again, this is the part that's really, really difficult for most parents, because when our kids are being little boogers and misbehaving, they are at their least lovable, and it's when they need the most love, which can be really, really challenging for parents. And we'll give you a little slide here to show you kind of what's going on. So when our kids are triggered and traumatized and anxious, depressed, their frontal lobes, which is where you can see in the green here, go offline. So you've got a kid who's super, super angry, and they threw their computer on the floor because they couldn't understand the math assignment. And you say to them, why did you do that? Like, why would you think that throwing your computer was going to help you do your math? What were you thinking? Again, a lot of times the answer is, I don't know. And they probably really don't know, because that part of their brain is offline. So that's the part of your brain where you're making decisions. What can I learn from this? What can I do? Because they've gone into their emotional state and their survival state of their brain. Now, that survival part of your brain is what you're actually engaging during an actual crisis. And so for some of these kids who are triggered, they feel like they're in a crisis. They're not thinking ahead to consequences or what could I do instead, because they're in survival mode. And so a lot of our kids right now are living in kind of that constant state of being highly agitated and triggered all of the time. And the mistake that a lot of parents make is, my kid is melting down, or my kid is having difficulty managing emotions. You know your coping skills. We've talked to you about taking a walk or taking deep breaths. Just do it. And then they refuse to do it. I hear that from many, many families. And again, it's because you can't teach a drowning man how to swim. When they're in that survival state and that emotional state, and they're not feeling safe, and they're not feeling loved, even though as a parent you're doing everything that you can to help manage their environment and help them feel loved, they just can't access those higher brain functions to get to the coping skills that they're trying to use. And so it's our job as parents to kind of bring down the temperature. We'll talk about that in another slide here soon. But again, that can be really, really difficult when your kids are, like I said, being little boogers and they're the least lovable. You just want to kind of like, why can't you get to any of this wonderful information that we've provided to you? And it's because of how their brains are being triggered. I see that there's a question.
Amberly, it's a question about their executive functioning not being fully developed.
Yes.
On the age.
Absolutely. So even under the best of circumstances, our kids, that part of the brain that deals with executive functioning is not even fully formed. So even under the best of circumstances, that's going to be difficult for our kids to access. But especially when they're triggered, and especially when they're traumatized, that's completely offline. And it's really hard to get them to do the things that you know would be helpful for them when they're in that really highly agitated state. Yes, very good point. That part of their brain isn't even fully developed. I want to say 23. I think 23 is when that finally is completely developed. Okay, does anybody have any questions about anxiety or OCD before I move on to depression?
One other comment, and you were explaining about anxiety, and somebody wrote that they've been seeing it with their 13-year-old, and hearing you explain it help them understand the situation.
Yeah, well, and sometimes those symptoms are really hard to miss because, and again, especially if your kid is operating from a place of anger and misbehavior, you want that to stop, and you don't want them to be in distress. And it can be hard to miss that what's driving the bus in that situation might be anxiety. They're not malicious. They're not trying to drive you crazy on purpose. Sometimes it feels that way, but they're really not. That really what's behind it is that anxiety. Good. So I'm glad that made sense. All right. So depression, this is being reported amongst 13 to 18-year-olds. And again, I would absolutely agree with that based on what I'm seeing in my office. So these are some depression symptoms. So psychosomatic complaints, again, the tummy aches, the headaches. One of the other common psychosomatic complaints with depression is pain. So if your kid's been pretty healthy and all of a sudden is complaining about constant body aches, especially when you look at it within the context of some of these other symptoms, it could be one of those symptoms of depression that's easy to miss. Is just, I feel like I'm in pain. I've got leg pains, arm pains, those kinds of pains. That could be something related to depression. Changes in appetite and weight changes. So again, when you're just not feeling your best, sometimes you don't want to eat. With depression, sometimes you could kind of go the opposite direction. We'll talk a little bit later about brain chemicals, but one of the ways that you get dopamine is from eating good food. And so sometimes that's kind of the only thing that's really helping them feel better. And unfortunately, a lot of times that takes the form of sugar and carbohydrates that gives you those good brain chemicals, which is okay in small doses. But if that's the only way that you're getting your happy brain chemicals, then that can be a problem, especially when it's combined with the decreased energy and lethargy, because they're not moving their bodies to kind of burn those calories off too. Hopelessness, sadness, pessimism. This is a really, really important one to look at, because when a lot of my depressed kids, I will ask them to kind of assess where they are. What do you have to look forward to? And when the answer is nothing, that is something that really worries me. Most of the time you can get kids to at least, do you know what your mom is making for dinner tonight? Are you looking forward to even eating that? And sometimes the answer is no. There's no point to life. I don't look forward to anything. I don't even care about the weekend coming up. Like, I hate school, but I don't even care because nothing ever feels good to me. That's something to really, really pay attention to and take a look at if that's happening. Sleep disturbance. So you're sleeping too much or too little. This can be a hard one with older teenagers because their circadian rhythms are changing. And so teenagers sleep a lot just naturally. But again, I think that you have to look at it within the context of the other symptoms. Is your kid staying up until 3 o'clock in the morning, sleeping into 1 or 2 o'clock in the afternoon, getting a snack, laying around on the couch, playing a couple hours of whatever they're doing on their screens, and then going to bed at 1 o'clock and starting the whole cycle over with nothing else in between? And especially if that's a difference, really take a close look at that, because that could be a sign of some depression going on. Loss of interest in activities that used to be enjoyable. This is another one that I would keep a close eye on. So even if your kid loved soccer, loved going outside, loved being with friends, liked to draw, liked to read, and now just does not have the energy to do anything, there could be some depression going on. And again, I would say in a neurotypical brain that isn't stressed out, there are some activities, such as that lack of hygiene. We'll look at hygiene, and then next bullet point could be an example of this. Just completing that task gives you enough dopamine to make the task itself rewarding. When you are depressed, that doesn't happen. So just taking a shower and being clean, that doesn't give me enough of my happy brain chemicals to make it worth it to me. And again, the hygiene can be tricky with older kids because they do go through this phase at 13, 14, 15, where showering just really isn't a high priority for them. And developmentally, that can be normal, but you just have to look at, how dysfunctional is it? And what does it look like in the context of all of these other symptoms? And again, the irritability and misbehavior, these are the real snappy kids. They're always arguing with you. They've always got a snappy comeback. Again, somewhat developmentally appropriate, but if it is all the time and you just can't break them out of that, we call them feedback loops. No matter what you say to them, they're coming back with something snarky and angry. It's something to consider that it might be depression. I see that we've got another question.
So the question is that you mentioned your specialty, kids with autism. Is there any differentiation of symptoms based on neurodiversity?
That is a long, hard question. There can be. I think that when you are looking, and that's like a whole other slide presentation, I will say that there's often a sensory component to some of these that are unique to kids on the autism spectrum, number one. Number two, anxiety and depression are often comorbid with autism. So if you have a kid on the spectrum who is also demonstrating some of these issues, sometimes it can, what they're struggling with are these comorbid issues that are exacerbated by the way that their brain processes information, because their brains are just wired differently, if that makes sense. That might be a webinar for a different day, but yes, there can be differences in how it presents in that kid, and some other considerations to take into mind. Like the loss of appetite in particular might be a sensory issue. But yeah, I could actually talk about that for 3 hours, so I should probably not. If anybody's got specific questions, I do have my email on the first slide, and I know that these slides are going to be going out to people, so I can answer individual questions later if you want to.
We'll plan another webinar with.
That's a whole other thing. But yes, good question. Excellent question. So the next slide is just about warning signs of suicide. So a lot of the same warning signs for suicide are the same as the signs for depression, with the addition of, here's the talking points: wanting to die or being really, really interested in death, having a lot of shame or guilt. And I want to talk about that one for a minute, because guilt is, I did something bad, and shame is, I am bad. And so kids who are really deep in it with that shame and just feel like they are fundamentally flawed, those are kids that you really want to start paying attention to. It's not just, I said something silly and now I feel bad and my friends laughed at me and I don't want to do that again. It's, I'm an idiot, I am no good, nobody loves me. Those talking points can be really serious. And again, those feelings of hopelessness, sadness, emotional or physical pain. Again, that physical pain can be one of those hidden symptoms that you don't really think of that might be depression. But if you've got a kid that's just in constant pain, back pain in particular seems to be one that pops up a lot. Just really keep an eye on that. Changing behaviors, making a plan, or researching ways to die. This is a tricky one too, because a lot of times our kids aren't going to come out and tell you that they're researching ways to die. And I know that it can be hairy with devices and social media. And I'm not advocating that everybody go grab your kid's device, but again, you have to look at that in the context of all of the other symptoms. If your kid just doesn't seem to be enjoying anything and is always sad and is always negative and is withdrawing themselves, not enjoying the things that they used to, I would want to kind of get in and see what are they saying, what are they researching, what kind of media are they consuming. Not every kid that watches horror movies or violent films is depressed or suicidal or homicidal, but you also have to look at that in the context of everything else that's going on with that kiddo. Some of the older kids too, taking really dangerous risks, such as driving fast. I also see this with risky sexual behaviors, multiple partners. And again, sometimes you don't always know that the older kids, maybe sometimes the younger kids, are engaging in some of these. And that's why it's so important to keep communication open. Extreme mood swings, eating or sleeping, using drugs or alcohol more often. If your kids are exhibiting any of those and just really can't get out of the dumps, even after you've had some conversations and normalized some of those feelings, it might be time to seek professional help and let a professional kind of guide you through some of that stuff.
Amberly, could you for a second just talk about cutting behaviors, and if you observe that there's some cutting or burning behaviors, whether or not, you know, how to respond to that for parents?
Yes, so that could also be anxiety and depression. Sometimes a lot of people associate cutting and self-harm behaviors with suicidality. Sometimes that's the case, sometimes it's not. There are different factors driving that. For some kids, it is a physical release of their pain. Some of them are doing it as kind of practice behaviors. You know, am I brave enough to make this cut deep enough to actually commit suicide? That's not always the case, though. I think that's another one of those situations, though, if you're seeing it, to get into a professional to figure out, is because for some kids too, it's a sensory thing, oddly enough. And it's taking it back to autism. I know I'm kind of all over the place here, but so with some autistic kids that cut, the way that their brains processes pain is different. And so that experience of cutting themselves is also different. And it could be they're seeking sensory input because their bodies under respond to other sensory input. I hope that makes sense. Does anyone have a more specific question about that?
No,
there is an increase, though. When stress is increased and you're already anxious, there can be an increase in that kind of behavior, like rubbing, scratching. There have been a couple of cases that I've worked with where some of that, they don't even consciously know that they're doing it. It's like it's an anxiety response, and it's almost like a compulsive behavior that they can't stop.
Thank you.
Okay. So how much time do we have? Oh my goodness, I gotta talk quick. So supporting your anxious or depressed child starts with you. Everybody knows the whole, you know, put your own oxygen mask before you put it on your child. Under the best of circumstances, our kids trigger our issues. And so it's really important that we know what are the behaviors that my child engage in that really start to make my temperature rise. All of my families that have worked with me for a while, and a lot of the people that I supervise, have heard me use the thermostat story. If you know how a thermostat works in a house, the thermostat controls the temperature of the house, and a thermometer responds to that and goes up and down depending on what does the thermostat say. So in a household, the parents have to be a thermostat. We are setting the temperature in the house. What happens a lot of times is kids have a reaction, we react to that reaction, they react to our reaction, and it just keeps building up and up, and it makes a mess. So as much as we are able to, we have to keep the temperature here, even when they're trying to raise the temperature, because we are the thermostat. We need to get them lowered to our temperature. We can't rise to their temperature because nothing gets done. Then everybody is in that middle brain, survival brain state, and it's a mess. And you do this through self-care. And again, through the pandemic, this has been very difficult. So it's a simple fix to say, you know, eat your fruits and vegetables, get plenty of sleep, get exercise, tap into your social support systems. It's a simple fix, but it's not an easy fix. This can be really difficult. And if you recognize that this is difficult for you, that's when you might need to tap into some help and figure out how you can get some of that on board, because without that self-care and self-awareness, you can't do that last piece. So self-regulation is my ability to keep my temperature low so that my kids can regulate with me, and that's co-regulation. Co-regulation, more than anything else, is going to help the temperature of your house. If you are able to share your calm with your kids, that's going to be what helps de-escalate them the fastest. Other things you can do to support your child: listen to and validate their feelings. This is important even when what they're saying doesn't always make sense to you. You remember the example I gave of, I don't understand the math assignment, so I threw my device on the floor. Well, you're never going to say to your child, yeah, that was a great choice. You were mad, so you threw it on the floor. What listening to and validating that might look like, though, is, I get that was really, really frustrating. That was really hard. You weren't really sure what to do with your body. And that was really difficult for you. Not the best choice to throw your device on the floor, but I absolutely understand how frustrating that is. Let's go make a better choice. Encouraging and facilitating social interactions and encouraging exercise, healthy food, sleep hygiene. I'm using the word encourage I will not use the word force or mandate. That will backfire, especially as your kids get older. But as much as you can, encourage them to do the same things that you're trying to do for yourself. You know, eating healthy meals, getting outside and getting some sunshine, doing all of that will help. You're just trying to set up their environment to be as less stressful as possible. This is the one, the minimizing stress and lowering expectations. This is the one that I probably get the most pushback from for parents. I would like to speak just specifically on grades right now. If you're a household that, you know, we do A's and B's in this house, you know, do the best that you can, and your kids are coming home with C's and D's over the next couple of years, or not maybe next couple of years, but over the last couple of months, it might be a time to minimize your expectations for what your kids can really do, somewhat with chores. And I'm not saying don't make them do their homework. I'm just saying that right now they're under so much stress that even my straight A kids right now are really, really struggling. You know, we can look back on what we talked about before with being back and forth in school and not being able to regulate their feelings. It makes it really hard for that frontal lobe to get online and do what it's supposed to do for them. Ask about suicidal thoughts. Your kids aren't necessarily going to be openly talking to you about these feelings. If your child is very depressed and you suspect that that might be something going on, take a minute to check in with yourself and in a very regulated way, ask them about suicidal thoughts, validate the fact that sometimes people have those thoughts because they're just so sad and that they just don't know what they can do for themselves to feel better. So I know that that's a scary thought, and I know that that's disturbing, and it hurts me to hear you talking about that, but this is something that I can help you with. We can get help with that. If your child is admitting to having suicidal thoughts and you have weapons in your home, please, please, please keep them hidden. I think the highest rate of suicide for boys are with boys who have access to guns and also have impulsivity issues, because again, that frontal lobe isn't fully developed, number one, and also it's offline if they're triggered. So they're not thinking about consequences. So if they have access to a weapon, a lot of times they will use that weapon. And also keep meds locked up if you have to. And then this last one, I'll stop so that we can take some questions. I talked too long, I'm sorry. This is just a fun activity that I've been doing with some of my families, and it's something that you can just use for yourself. The different happiness chemicals and what you can do to kind of hack them and get that going for your brain if you're just having a hard time. So the dopamine is the reward chemical, and again, that's the one that is difficult to create for yourself if you're depressed. So taking a shower, that's not necessarily going to give you the dopamine. So kind of be detectives in your family. What can we do to get some dopamine? You know that you need the dopamine if you're just feeling kind of purposeless and blah. Oxytocin is the love hormone. You know you need oxytocin if you're feeling lonely. So get with a pet, play with a family member, find a friend. Serotonin is the mood stabilizer, meditating, running, getting out into that sunlight. You know that you need this if you're feeling really agitated, angry, irritable. You might need some serotonin. And endorphins if you're in pain. So watching a comedy is a good one for these kids, because a lot of times if you can't get them off the couch to do exercise, maybe put on a really funny movie with them, get them laughing. That's a natural painkiller. I also tell kids who have dogs that if you take a walk with your dog, that hits all of these. You're rewarded because the dog needed to be walked. You're connecting with an animal. It's giving you warm fuzzies. It's stabilizing your mood because you're out walking in the sunshine, and you're getting that exercise. It's giving you the endorphins. Okay. Do we have any questions? Sorry if I talked like a freight train. I had a lot to get through.
Amberly, could you talk for a second about, you know, if a parent is concerned about their child, particularly with depression, but the say a teenager doesn't really, you know, comply with going or participating in therapy, what should a parent do in that situation if they can see there's a problem, they're doing their best to get their child help, but there isn't real buy-in from the teenagers in particular?
Yeah. So I would kind of start with those, like we just know that the good food and the exercise and all of that stuff would help you. If you approach it from a position of, can you just try this? I'm not going to force you to do it. Can we just try this as an experiment? Using that kind of language sometimes will help with buy-in. I'm not going to force you. Let's just do this as an experiment. If it doesn't work for you, we'll try something else. Rather than, you know, Miss Amberly says that you need serotonin, so you need to go outside and take a walk. Like, if they feel like it's a demand on them, they're not going to comply with it. But if they feel like they've got some say into what they can do, that helps. So even, you know, here are some examples of some things that we can do to feel better. Are you willing to do any of these things? Maybe just pick one thing that you're willing to do. If they feel like they have a voice in the decisions that are being made, you're going to have a better chance with buy-in. And even with seeing a therapist, I think something that I tell a lot of my teenagers that come in like this and don't want to talk to me is, I get it. I know that you don't want to see me right now. Give me a chance. Give me a couple weeks. If we're not gelling within the next couple weeks, then maybe I'm not a good fit for you, and that's okay. That's okay. We can find somebody else, or we can do something different. They just need to feel like they've got a voice in it.
Okay, thank you.
Yep.
Do you want to do your second poll about self-care?
Oh, I forgot. I forgot. Yes. Yes. That's a good poll question to end on. Yes. Is it up? I don't see it.
Sorry, my computer froze.
Oh, okay. I was like, is it me?
No, I was trying to pull up your second poll, and I hope that I can do it.
Mm-hmm.
Oh Lord. Okay, let's see here. There we go. And launch.
There we go.
So you're asking how we would give
You yourself. What grade would you give
ourselves.
yourself?
And we'll share the results here. Do you want us to go another 10 seconds or so?
Yeah, go ahead. Yep, we'll do
Okay,
that.
we'll give people 10 more seconds to grade themselves on how they're doing with self-care and self-regulation. Okay.
I see you, Fs. I've been an F. I see. I get it. All right. It looks like B's and C's. We're a B's and C's group. Yep. So just know that is going to help you work with your children when you are regulated and when you're taking care of yourself. And I know that that's not always an easy fix. But everyone's homework this weekend is to find at least one of those happy brain chemicals to hack. It doesn't have to take any money, even if it's just sitting outside for serotonin, you can do that. So that's everyone's homework for the weekend.
Amberly, we are out of time.
Okay.
Thank you so much for your presentation today.
Absolutely.
It's so important, you know, that we take care of ourselves, but also, you know, see what we can do to help young people, you know, through what we know this process, you know, that the pandemic will end.
Yeah.
We're getting there, you know, but from a young person's perspective, it can be hard to believe that, you know, that it's going to happen sooner rather than later.
Absolutely.
Really, thank you so much. We will
Thank you.
recording available, and if everyone can take a look for the evaluation link, I'll send that out in the next 15 minutes. We will send the PowerPoint presentation, your certificate, and a list of resources, community resources as well. So thank you so much.